This is Claire and Mark from C.O.R.E Physical Therapy and Sports Performance, coming to you with an informational video on the effectiveness of lower back pain, dry needling, when we use it, and how we implement it into our rehabilitation strategy.
Dry needling is by no means the end-all, be-all treatment for low back pain. However, it can be an effective tool when used appropriately by a healthcare provider that helps to decrease pain, help get patients over the initial hump of acute low back pain, and lets us progress into gait analysis, movement mechanics, and getting deeper into the actual problem of what's causing back pain.
It's important to make sure that we look at the entire picture of what's going on and not just focus on symptoms.
The patient case that we'll be discussing today is a young female who has pain and symptoms of back pain with prolonged sitting due to her job. She also has a history of compression fractures from motorcycle racing.
Careful palpation of the trigger points prior to needling is imperative to a safe and timely, effective dry needling session. Now, this video is sped up 2 times to make sure that we show the entire process in a timely manner. This patient in particular has a history of compression fractures, so we're careful to make sure that we get above and below the location of all palpable trigger points. All right, here we're getting back to the bread and butter. We use the needle and the guide to carefully get inside the trigger point, carefully piston in and out of the trigger point, eliciting a localized twitch response, and then very quickly removing the needle. Generally, this process is not overly painful. Sometimes you will feel a twitch response and a radiation of pain in the referred pain location at times. But again, this is a very fast and timely procedure. Trigger point dry needling is a very fast, effective, and safe procedure. We do not leave needles in after we have performed the trigger point release.
As great as dry needling can be for certain people and diagnoses, remember it's not a treatment option for everybody or for every treatment diagnosis as well.
It's important to make sure we look at the global movement system: strength, range of motion, and symmetry of motion, and quality of movement. Is there weaknesses? Are there range of motion asymmetries? Those are all very important in the grand scheme, and dry needling is only one component to help us get back to a baseline.
Make sure that you ask your healthcare provider if dry needling may be an appropriate treatment option for you, or if you have any questions, then reach out to us here at C.O.R.E Physical Therapy and Sports Performance to see if dry needling would be appropriate for you and your pain and symptoms.